My guest is a passionate advocate for policy and change. She brings her voice and vision to coalitions, panels, and publications focused on health equity, climate justice, food access, and housing. She joins us on this episode to share her journey. You're listening to the PHEC podcast, episode 418. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. My guest is a passionate advocate, and her focus spans climate and health, access to care, and reproductive justice, all through a lens of equity and community power. She joins us on this episode to share her journey with us. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, helping our clients communicate their health information in plain language to the community partners as well as the broader communities they serve. This support we provide often falls in the category of strategic planning and sometimes capacity building. Please reach out to us through our website at drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links to our site will also be provided in the show notes. I am excited to introduce all of you to my guest on this episode. So let me formally introduce her to you, and then I'll connect our conversation. Robyn Bussey is the Just Health Director at the Partnership for Southern Equity, where she leads bold, equity-driven work to advance health justice across the South. In this role, she supports communities, organizations, and advocates working to understand and take action on the deep connections between racial equity and health. Her focus spans climate and health, access to care, and reproductive justice, all through a lens of equity and community power. Before joining the Partnership for Southern Equity, Robyn served as the community health strategist at the Atlanta Regional Collaborative for Health Improvement. She also served as a senior research associate at the Georgia Health Policy Center, which is in the Andrew Young School of Policy Studies at Georgia State University. Rooted in the belief that racism, not race, is the fundamental barrier to health equity, Robyn is passionate about dismantling systemic injustice and amplifying the voices of Black and Brown communities across the South. Her career includes leading health improvement initiatives across Metro Atlanta and designing programs that address the root causes of health and social inequities. Robyn brings her voice and vision to coalitions, panels, and publications focused on health equity, climate justice, food access, and housing. She holds a Bachelor's of Science in Biology from Florida A&M University and dual master's degrees in Business Administration and Health Administration from Georgia State University. A proud daughter of Waycross, Georgia, Robyn now lives in East Point with her son and brings both her lived and learned experience to every conversation she joins about justice, community, and collective well-being. Let's connect my conversation with Robyn right now. Oh, hi, Robyn. Welcome to the podcast. How are you?
I'm doing well, Dr. Charlotte. Thank you for having me.
Oh, it's my pleasure. It's really nice. We're chatting a little bit before I actually hit record. And it just felt so nice. We're just all across topics about this and that, getting ready. So I thought, let me go ahead and actually get us started here. You and I met at Policy Action Institute in Washington, D.C., where you were a speaker on a panel that I was moderating. And I knew right away that I wanted to invite you to the podcast. I like so much of what you had to say.
Thank you.
And so I'm excited to have you here. Why don't we start with you? Just give a little introduction to everyone. Tell them a little about yourself.
Sure. So again, my name is Robyn Bussey, and I live currently in East Point, Georgia, which for those who are not familiar is basically Atlanta. I live in a suburb of Atlanta, Georgia. I always say if you ever flown into Atlanta, then you know where East Point is. But I'm originally from Waycross, Georgia. For those who don't know, if you ever heard the Okefenokee Swamp, that's Waycross, Georgia. So it's South Georgia, just the country. And I always say that recently I say I'm a health equitist. So I am someone who is really focused on health equity, which basically means that I believe that everyone, no matter who you are, what you look like, where you're from, who you love, what your grade level is, your reading level is, that everyone, whoever you are, you're entitled to health and well-being, good health and well-being. So my work is really focused on making sure that all people, no matter who you are, that you have access to good health. And that means that I work with people of all stripes, of all communities, particularly in Atlanta and across the American South, to really, help them understand what health equity is, understand the history of health inequity, particularly from the racial inequity or racial equity standpoint, to understand how we got to this place, why some people have better health than other people, and just understand how they can advocate for better health, particularly for themselves. On the other hand, I also help organizations like health systems, governments, and other organizations understand how they play a role in health inequity and how they can do better to make sure that they can contribute to better health as well. So really just working hard to make sure that people get healthy, particularly Black people and other people who have been left out of good health can access better health in a nutshell. And I do other things as well. I'm a mom, an aunt, an auntie as I'm called. So all those other fun things. But my day job and my passion is really making sure that folks can access good health.
I really appreciate that introduction. That's one of the better explanations of health equity that I've heard in a very inclusive way, but very clear for people to be able to understand what this means. And I pay attention to that. We're always searching for how do we explain what we do? It can be a little bit of a challenge sometimes. So
Yes.
you did that very well. Thank you.
Thank you. I come from a family, no one knows what I do. So I'm just trying to practice so that people can kind of understand what it is I do. So thank you.
Well, let's dive in a bit. I'd love to hear about the journey. And so one of my favorite questions with all of my guests is to kind of find out, roll back and discover the beginning. So do you remember a time when you first heard about or became interested in public health?
Yes. That's kind of an easy-ish question for me to answer. So my mother is a retired public health nurse practitioner. And so all my life in some way or another, I've been surrounded by public health. So I grew up, again, in the country. We had one public health department, and she was a public health nurse and always been around the public health department, got some of my first shots at the public health department, hated those shots. And, back when you used to call your mom at work, that's where I would call. And it's very interesting living in a small community. And she was probably one of 2 or 3 Black nurses. So people knew her. And, just going and being in the community, everybody knew her. Her name is Connie Bussey, and people call her Miss Connie. And we would, sometimes just be at the store and people would be like, Miss Connie, Miss Connie. And like some people would be like, she was a women's health nurse as well. And somebody would be like, Miss Connie, I have an itch or something like that. We'd just be at the store and I would just be mortified. People would just come and ask her questions. I'd be so embarrassed. But she's just the nicest person. She's like, just an angel. And she was like, oh, you need this or you need whatever. And I would just be so embarrassed that people would just come up to her and just ask her all these questions. But she would just pull them aside and like do her work, be a nurse all the time and always help people whatever they needed. And she just would always attend to people. So that to me was like really just helping people wherever she was. I mean, people would call the house And it wouldn't always be about women's health, but I mean, if people had a headache or whatever, that she was like really the community nurse. So that's why that was kind of my exposure to public health, as it were. And just kind of, I was always around that. And so I always realized that people needed help or needed, access to health, no matter where they were or who they were. So that was really my introduction, whether I knew it or not, to public health. And so I, understood the need, to always have that care. Very quickly realized, and through her guidance, that nursing was probably not my path, but just always understood that people needed that care, and there was some way to provide that care for folks, and that again, no matter who you are or what you look like, you deserve that care. So that was really my kind of introduction and my desire to be in or around public health. I didn't exactly know how outside of being a nurse, but just always knew that I wanted to be in that field somehow. So that was my, I guess, introduction to public health.
That is such a great story. That says so much about your mom because, we talk a lot. If you listen to like conversations today, it's about genuine connections and building trust in the community. And your mom, for her to have that level of trust from the community, I know so many people right now, organizations wish they could bottle a little bit of that up and have it for right now. That's not something that is for some people, it's very natural, like your
Mhm.
mom. It's just a very natural way of as public health professionals, we're very caring, right? But when we hear something like that, for me, when I hear that, that stands out because I know that is a huge challenge for everything in public health right now, just well, really broadly in the world. Organizations, even well-intended organizations that have not done a really good job of connecting with communities, and they really want to, but they don't have a clue how to do it, and it's so difficult for them. And so, like, those of us that feel like we're natural connectors or that's just, like, part of our DNA, we need to know that that's a really powerful strength.
Oh, yeah. Still to this day, people are like, "How's your mom?" Or they still call or go up to her, and she's still, "Well, you can get this." Yeah, she's yes, retired for 15 years, but she is still the nurse for Nurse Bussey is what they still call her. Yeah.
I love that. So, what about for you? Is there any particular population or, like, public health condition or issue that you're really passionate about right now?
Yeah, for sure. So, like I said, rural health is really just really important to me. Again, realizing that there are just so many challenges for folks in rural communities, just access being one of them. As rural hospitals are closing and have closed left and right, just that access piece is so huge. Again, growing up where there was one hospital, there continues to be one hospital in my community. There's all these care deserts wherever you look. Maternal health is really huge for me. Again, my mom being a women's health nurse, I'm just really compassionate and really care about maternal health. Women's health is really huge for me. Again, I think I talked before about really caring about Black women, really centering Black women and Black femmes in my work. But in general, just folks who just don't are always left out of the conversation or generally left out of the conversation. So whether that be low income folks, low wealth folks, rural communities, even, folks who are undocumented, our LGBTQ plus folks, just people who are often relegated to the margins, who I never like to say people who don't have a voice. Everybody has a voice, but those voices who are often just not heard or overlooked, just the folks who have something to say but just are just often overlooked or just not listened to, just making sure that those folks have the access that they rightfully deserve. So really anytime they can be amplified, they can be seen and be heard and have that access, those are the folks I'm always fighting for and rooting for, and using that little bit of privilege I have to be like, hey, listen, over here, these are the folks we need to be making sure that we center. But definitely, I have to say, all things maternal health is really, where I start. So wherever that intersects with climate, with mental health, access in general, that's really where I focus. So I guess the sweet spot, because I love a good old Venn diagram. I love how they intersect. So probably, Black maternal health, rural maternal health is probably the sweet spot for me.
Yeah, yeah. So much of that resonates with me living in a rural area. and just really realizing some of the unique challenges as early years was in a very rural community, and then like teenage to early adult, young adult, I was in a more urban setting just outside of Washington D.C. So and then later in life now I've gravitated back to my whole state. I'm in South Carolina, so it's pretty much a rural state. So having lived in, kind of both of those areas extensively, just really firsthand understanding the differences, the nuances, and the challenges. So there's always more. I feel like whenever there's more need than has been met, and so I think if anybody is interested in focusing in rural areas and they think, "Oh, well, somebody, so many people are already doing that," there's more work to be done. So we
Absolutely.
still
Absolutely. Especially again, like in Georgia, I always say, I mean, there's 159 counties. And because, people think about, oh, there's Atlanta, right? There's Atlanta Metro. But depending on the day you ask, there could be 22 to 32 counties that is considered the metro. So there's a whole bunch of other counties that are not metro, that are rural. And that's a lot of just land mass, period, that needs to be covered. So there's a lot of concentration in one small part of the state, but most of the state is not that. And so you really have to consider there's a lot of the population outside of the state, to your point, that is rural. So there's a lot of work to do. You're right. There's so much to do. There's lots of opportunity. If you want something to do, we got something for you to do for sure.
Well, tell us a little bit about your current role. What do you do and how do you serve?
Yeah, so currently I serve as the Just Health Director at the Partnership for Southern Equity in Atlanta. So we are a racial equity organization in Atlanta. We focus on advancing policy and institutional action to advance shared prosperity and growth throughout the American South. And we do that through an equity ecosystem model. So again, recognizing that people don't live single issue lives. So we focus on different areas like climate, energy, economic growth and development, equitable growth, youth power building, and health equity. So I lead the health equity team, which is Just Health. So we're just everything. So just energy, just opportunity, just youth. We just launched Just Youth and things like that. So Just Health is my area. So I focus on building really community capacity. So building leadership in communities, again, understanding there's plenty of power and plenty of voice in communities. So really organizing that voice and power to be able to advocate for health equity, and then bringing them together with organizations, convening them in one area so that there's shared decision making to really start to advance health equity in areas so that there's not a lot of extraction from community. We do those beautiful community health needs assessments that have to be done every 3 to 5 years, and we have to go and offer the Chick-fil-A. In our instance, we always go and do the Chick-fil-A, and we get all this data and how can we help and write this beautiful report. But we want to make sure that you do it actually with the community so that once you write the report, the data goes back to the community, that you're actually co-designing initiatives so the community's right there at the table throughout the whole process. And so, once you start to actually implement those things, community is there and actually has input. So just kind of making sure we can really kind of do that together. And so we have what's called a Just Health Academy so that we walk community through, or whomever's interested. If you have any interest in health equity, it's like a learning journey, probably about 8 sessions. So we go through different health equity topics. You learn about these things. You develop a community-based project based on your learning so that you start to be able to understand a little bit more deeply about health equity topics. And then you become a health advocate, a health equity champion. So now you're in the fight. So we start to just build this kind of, lack of a better term, army of health equity advocates so that, again, you are more informed and you can start to say, I see all these things going on in my community. So now I know what these things are and I know how to advocate for myself. So we do things like get folks certified as mental health first aid. They also understand how to reach out to their local legislators, how to advocate for themselves, things like that. So you're getting kind of these practical tools as well, so that when there is an issue around environmental justice or things like that, you can understand what they are. You can start to advocate for yourself. So just really trying to build that community power, doing training and technical assistance, and just, understanding what these policies are. And again, understanding the historical basis of how they're rooted historically, and just, kind of spreading education, training, and technical assistance. So that's kind of some of the work that we do around 3 main areas: climate and health, access in general, because again, we're rooted in the South, not expanding Medicaid anytime soon. So, really trying to understand and make sure that folks in these rural areas and in the South in general have access to health as best as they can. Of course, all those social drivers of health, food, housing, and things like that. And then, of course, my one of my passion areas, reproductive justice. So again, there's maternal health again, access to contraception, access to abortion, all those things that are being taken away. How can folks still have access to those things and be healthy? So those are some of the areas that we work in. And those are, some of the issues that I'm really passionate about, and just really getting folks to understand how they can advocate for themselves. That's some of the work I do at PHEC, Partnership for Southern Equity.
I love everything that you've just described. And you mentioned the academy. And so how do you recruit people or advertise the academy? And is it easy for you to get people involved? Are they ready to, come on board? But are these community members? Tell me a little bit more about that.
Yeah, so we just graduated our second cohort early June. So it's relatively new. So our first one, I'm a researcher by nature. And so our first one, we did it with what's called our Just Health Circle. So we have a circle of our partners, folks who, have worked with us before. So it's very easy to join our circle. And everybody can join our circle. I can share more information about that. So I really wanted to just kind of test it out and see how it worked. So that was all virtual, just to kind of, do some topics and see how that one worked. So that was really easy to advertise. We just kind of did it with our circle. Are you interested in joining? And people signed up, and we went through that first one. So this one was a little different. It was more place-based. It was more local because our circle is statewide. So this one was just based in Atlanta. We just reached out. We reached out through our socials, through our networks, and just said that we're launching our academy. If you're interested, please apply. It's pretty easy. Like if you're interested, just kind of sign up. So we had, I think, 20 people or so signed up. I think 20 people signed up. I can't remember, but we ended up with actually 11 people graduating. So, because some people fell off because it's like a 8-month session. It's actually 7 sessions, and then the last one is graduation. So it's 8 months total. So it's like one Saturday a month over the course of 8 months with one session each month. So we reach out through our socials. So it's really just, if you're interested, sign up. So we go through an application process. We can only take, so many people. I think 20 might have been our limit. And if anyone's interested, really, if you have an interest in health equity, it's a relatively simple application process. It's kind of why you're interested, what your capacity is. We kind of let you know up front what the time commitment is. And we do offer a stipend because we understand the time is valuable. We really want to, we can't totally compensate you for your time. We want to offer a token of appreciation. And then, like I said, there's a project at the end, a community-based project. So based on what you've learned, what your interest is, we want to just kind of see what you've learned. And so, yeah, we just kind of recruit folks and see who's interested, and they sign up. And then, you just go through the journey with us, and we go through the journey together. So we hope to launch it again in the fall. Like I said, we just did our first kind of outward launch. It was our hybrid. So we had an in-person session, and we had our some online sessions. The goal, again, I'm always looking out for my rural communities, is to actually do it all over the state and eventually all over the region. So me with the vision and the big ideas. But yeah, we want to do it again this fall. We'll probably do it again in the Atlanta area. And then, maybe eventually go to South Carolina, kind of get on out of Georgia eventually. But yeah, hopefully we'll do it again. We will do it again in the fall. Just, anyone who's interested can just sign up. We'll have it on our socials, and just reach out to folks. And like I said, anyone who's interested, it doesn't have to be a community member. It can be someone affiliated with an organization. It's not that restrictive. But if you have any interest in learning more about health equity, you can certainly sign up and apply and come with us on the journey. And we are offering mental health first aid as part of the academy going forward, because that's really important to us to make sure folks, again, leave with something they can take with them beyond the academy, for sure.
And then you mentioned also reproductive health and rights and helping women with access to services that are disappearing, like abortion services and contraceptive services and support. How is that going? How is that being received? Are you able to, I guess the better question may be, how restricted are you, or how much are you able to help? Because if these services are kind of disappearing, how are you helping to find them?
For us, that's a little different because there are a lot of people doing really great work on the ground. And so for us, it's really trying to find how can we kind of support them. So there are a lot of great organizations like the Black Mamas Matter Alliance, Sister Song, who are doing absolutely great work. So our thing is like, where can we fit in? So my thing is, how with our expertise and our work, how can we just kind of amplify the work that they're doing, number one, and then how can we just kind of amplify the issues for our community so that they know what the issues are. So they know, for instance, about the 6-week abortion ban. So they know what the issues are. How can they advocate for themselves? How can they connect to the sister songs, to the Black Mamas Matter alliances so that they can support them as well, that they can know what their options are. Just really being that conduit for them. Again, amplifying the work that they're doing, just kind of making sure, again, the communities are really knowledgeable about what's going on. Just, again, not trying to recreate the wheel, not trying to get in on the work that they're doing, but being supports to them and just really, doing the work that we can do in support of them is really what we're doing. But yeah, just, again, get in where we're fitting in and supporting the good work that's being done is really where we are right now.
This sounds definitely really rewarding work. I mean, to be every time you're able to get involved in community and be really closely connected, seeing impact like that, being able to, whether it's connecting resources or having a creative new kind of program that you're testing out and just meeting the needs of the people is just, I guess that's what a lot of us sign up for in public health.
Yes.
We
Oh,
want to be able to
yeah.
make a difference, right?
Yes. Yes.
So what are some of the challenges that you face in your current role and just in general trying to do the work that you're doing, and how are you addressing these challenges?
Yeah, well, like you said, it's so much. I mean, it's so much. It's something new every day. It's first of all, is what do you tackle? Because I mean, every day there's something coming down the pike of something you got to address. So you can't tackle everything for one thing, and you got to just really decipher what can I prioritize today. And especially for us, we are in the unique position for us in our organization where we did not or do not take federal dollars. So we have a little bit more freedom that other organizations don't have. And so a lot of people are looking to us to be able to kind of use our freedom where they can't. And so we still have to be very mindful of, again, what we can handle and what our capacity is, because we're still challenged too. I mean, we're not the biggest organization. We still face challenges with our funders as well. So we just have to be able to prioritize, our capacity and what we can handle. So that is a challenge. And just, being mindful of what we can logistically handle without being burnt out. It's just hard. Like you said, sometimes you want to see those big wins, but you have to be okay with those smaller ones. Like you still have to be okay with, like you said, if it's nothing more than a small program got off the ground. Or for me, if you were able to establish a new relationship that, you've been trying to establish for a while, and today somebody returned your call or somebody answered your email. Like, to me, that's a win. It's like somebody you've been trying to get to, and just even maintaining our relationships, particularly in this environment. Having conversations like these for me is a win. Like, there are people who are still in the fight with you. I think is really important for me, that to know that you're not alone in this work, because it's scary. It can get scary. I'll say scary, but it's still good work. And I believe in the work, the fight. You got to still have the fight in you. So that can be a challenge, because some people are either tired or they're kind of apathetic. Like, okay, that's another thing we got to do. It's Monday, so what we got to do today? But you still got to have some kind of passion to keep going. So that can be a challenge, because again, it's so much. And as always, the M word, money. That's that's always a challenge for everybody. How are we going to have enough to do what we need to do? But we still get it done. I think there are ways to get it done. There's still folks who believe in the work that we do and who are willing to support us. So, we just got to find them, and we just got to do a little bit different with what we have. We've been here before in some kind of way. So I think we just have to be a little bit creative. But, you just change a little bit, but you just keep going.
Yeah, I appreciate your response and your honesty on that, because I think a lot of us have felt this. This is, we're recording this mid-July, late part of July. We're about a good 6 months into this new administration, and,
That's
one
all.
of the yeah.
Yeah.
And one of the big things that comes up, and I heard you talk about this or you raised this question, is and I found myself doing this, if you've been speaking anywhere in the last few months, whether it's virtually on a stage, one of the big questions, especially when you're talking about public health and topics of equity is there a filter? Can we say equity?
Mhm.
I mean,
Mhm.
and, you
Mhm.
bring a point. It's in the title of the place you work. It's everything that you stand for and believe in. So, it's like, did you really imagine you'd have to ask that question,
Yeah. Yeah.
at one point? But it does feel heavy for a lot of people, and it does feel exhausting, and I really don't have any judgment when people decide it's too much and they have to back off. It's not I don't take that as, they're giving up or it doesn't matter to them. I think that sometimes it's just too much and people have to pause and, like, digest and regroup and figure out what they can do, and
Yeah.
that's very fair, right? We all have to at some point
Oh, for
kind of
sure.
reassess. But what I love is that you are leaning in and you're just simply, "This is just what it is, and this is what I do." And that feels very it's inspiring and it's soothing because on the other side of that, I also engage with a lot of people who just don't know what to do and feel very stuck. So, you know what I mean? Like, it's just
Yeah.
I'm hoping that someone's listening and hearing this from you and maybe it'll have that soothing effect on them as well.
Yeah, and I mean, to be 100% transparent, I mean, there are days and I'm like, "You know what? I think I just wanna go work at Mattress Firm." Like, that feels easy, I could just because
Right,
people
yeah.
know what they want. They come in there and they're like, "I want a queen size." Like, "Here you go." But then it's like, you know what? That's not what you want. That's not what you're here for. So you have those moments and then you get up and like, okay, this you will not be happy doing. This is not what you're here for. So you get up and then you do what you have to do. So you are allowed to have those moments. But they're just moments because again, you like you said you realize that that's not how you operate and that's not going to get people to where you feel like people should be. Because again, like I said, I just refuse to believe that all people should not have access to good health. That's just me at my core. I don't believe that. So at the end of the day, I don't believe that me sitting in a mattress firm pointing people to mattresses is gonna get there. So while it seems fine for that moment, I gotta get back up and do what I gotta do. So yeah, you can have those moments, but also you gotta get up and get back to what your core is.
This is a great example of the calling. This is more of a calling to this work, right, than just the job, so
Yes, yes, for sure.
So we have a variety of people listening to this podcast. I mean, they could be students or early career professionals on up to senior career professionals or people who are not even traditionally trained in public health but are interested and curious. So we have just a variety of people listening to this podcast. I wonder if you have any bits of advice that you could share for people who are listening and maybe interested in something similar type of work.
Yeah, well, I am not traditionally trained in public health. I am definitely that person. I can tell you a little bit about my circuitous journey. Yeah, if my dad was here, he would definitely laugh. He's like, "What are you doing?" So just a little bit. So my undergrad degree is in biology. Because as we were talking before, talking about how I got to public health, I was on public health adjacent. I, wanted to be a doctor. I always wanted to be a doctor. Love biology. Like that's still my jam. So it's biology, pre-med in undergrad at Florida A&M. I'm a Rattler through and through. Should have said that in my bio.
Yeah, we have a lot of listeners from us, so they're probably shouting out too.
Hey, Rattlers. And, wanted to go to med school until organic chemistry was like my Achilles heel. I was like, what is this? What is this? And so I was like, maybe not. So graduated with honors in biology. Was like, okay, maybe not med school. And didn't know what I wanted to do. I graduated and, worked different jobs. Somehow got to accounting and IT. I don't know. Did well in that and went to grad school. Didn't know, started grad school pursuing my MBA at Georgia State. And I'm going to date myself. So started grad school with my MBA and started MBA, dual MBA and master's in health administration. And during that program is when Georgia State started its MPH school. master's in public health school. And I was in the middle and I was like, oh, I'm not going to change right now. So I was like, well, too late. So I completed my master's in business and health administration. So I didn't switch over, but they started their school. So I was like, well, I can't really switch over now. But so there were a lot of overlapping classes. But after that, I started working at the Georgia Department of Community Health. So I did some work around certificate of need, and then flipped on the other side, some consulting around certificate of need. Then I worked at the Georgia Health Policy Center at the Georgia State. So, but I've been, again, public health adjacent, but never actually formally trained in public health. But, again, just the love for public health, just kind of as I explained earlier. So just all that to say is that you don't always have to be formally trained. You should be. It's a great thing. I don't knock it. I always wish I'd learned more formal epidemiologies. I think that's so interesting. I just love data and all that good stuff. But there's a way to be involved and to kind of be around and to get there. But you can do it in your own way. It doesn't have to be so linear. And one thing I always tell people about this work, particularly when you're working with public health and community health, is that it's not 9 to 5. Please don't ever expect that it's 9 to 5, Monday through Friday. Not especially working with community. It's just not. And those huge wins, they are not, you don't see them very often, but there's so many small ones and they look different along the way. And you have to, I would say this, rethink what you consider to be huge. Because I think some that may not look like they're huge, they might not look like super grant-worthy, huge. I think they're still big wins, particularly when communities are happy and they are thriving and they feel like they won. That to me is a win. And the work takes a long time. So, the 3 to 5 year grant cycle, that's not it. But I still think you get your wins for sure. So I think rethink what you think a win is. Might be some advice to look for. But yes, just hang in there. I know it's probably not super profound advice, but hang in there. Just kind of rethink what it is. But it does pay off.
Yeah. Well, thank you so much, Robyn. This has been great just to catch up with you and to hear you share so much and your journey, and you're just it's an inspiring conversation. I feel like very inspiring. I know we're going to be sharing links to connect with you on our show notes page, but just what's the best way for listeners to connect with you?
Reach out to me on my LinkedIn page. You can find me by my name, Robyn, Robyn, Bussey, Bussey. I have no idea what the actual link is, but my name, I think you can search it by name. You can find me there. That's probably the best way to reach me.
Yeah, we'll add that link to your LinkedIn on the show notes page so that people can easily connect with you. So
yes, please.
Thank you so much for being here. I appreciate you.
Dr. Charlotte. Thank you for having me. I appreciate it. Always great to connect.
I really hope you enjoyed that conversation as much as we did. I encourage you to connect with Robyn and learn more about the work that she's doing. When you reach out to her, make sure you let her know that you heard her on this podcast. You can find the links to connect with her on the show notes page. The show notes page for this episode, which is episode 418, can be found at phecpodcast.com. Once you're there, just navigate to episode 418 to find the show notes. One more thing before you go. Remember that our podcast has a new app where we can continue the conversation from episodes like this one with public health professionals from around the world. You can download our new PHEC podcast community app in Apple or Google Play Store. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.